Oh,
Sorry, I'm here. Hi.
Oh, nice to meet both of you. Thank you for agreeing to chat with us.
Yeah, absolutely. Thanks.
Thank you. All right, we'll just get it started in the interest of time. One of my colleagues might be hopping on, but we can just go ahead without her. So as we explained before, your practice was referred to us by your MWI animal health rep, Amy Zopina, because of the work that you're doing opening the emergency care center. So we wanted to maybe get your thoughts on that process and then put an article in the next edition of our Messenger Focus magazine. That's kind of what's going to guide our conversations. There she is. Hi, Amy. I was just welcoming them and filling them in.
hello.
Hi. Sorry I'm late. Thank you guys for joining us. We appreciate your help.
We definitely do. Cool. So I'm just going to kind of go through the questions that I had put in the email and just kind of get your feedback on that.
Sounds great.
Great, perfect. So I guess to start with, can you tell us what prompted your practice to want to open a veterinary emergency care center?
Yeah, so it was kind of a all-encompassing decision. A lot of us came from kind of large corporate hospitals that were hit really hard with COVID, and we just felt not as supported. So we kind of got a call from a friend and talking about, would you guys like to take on this project? So we really kind of reached out to our friends. We all kind of know each other from training through our years of internships and residencies, and decided that this was what we wanted to do. So that's kind of how it started. We all left our lives and just said, okay, let's do it.
Yeah. And just to be clear, because I'm not sure from your question, so this was the start of an entire separate entity. So this was not opening up an emergency practice separate, on top of something else. This was starting an entire emergency and specialty hospital at once.
And I guess this wasn't a question from the list, but like, what was it about like emergency care in particular that kind of attracted you? Like, if you're opening a new practice from scratch, why emergency?
Yeah. So both Emily and I are emergency and critical care specialists, so that's an easy enough question to answer for us. But as far as why that is so integral and an important part of opening up an emergency specialty hospital is that a lot of what drives specialty care is also emergency care. They're very intrinsically linked. And so making sure that you are able to not only provide that care on an emergency basis, but then continue that care into inpatient and specialty care is really important to us. And I think that a lot of places kind of think about their emergency and critical care side secondarily, as just drivers of the other business, but especially for Emily and I, that's our gig. And in the places that we've worked, having a big focus on emergency care as actually a big part of equal to any of the other specialties allows you to provide superior emergency care and to make sure that you are treated well by the hospital itself.
Okay. And then kind of looking at it from like a business perspective, what do you wish you might have known before you opened this practice?
You have 3 hours. I'll let me start with this one.
I mean, I think that there's a lot of things we wish we would have known. I think we a lot of times took for granted the infrastructures that were already in place in these large hospitals, because really that's how we were trained, in hospitals that were already established. So for us to come in and have to design that management structure from square one, and none of us have an MBA, was difficult. I think, especially being emergency doctors, we need things now, we need results now. And we had to learn to take a step back, think about how to approach a problem, how to solve it, and then how to roll that out. So that's been a big learning for us.
And I think another big part of it that I think we took for granted coming from bigger hospitals was nursing structure. I think that is something where being in larger hospitals, the nursing structure is kind of laid out. And we just kind of came in there, and there, my last job, they're like, here are your 2 critical care nurses. And I was like, okay, great, moving on. Here, we had to figure out not only the nursing structure, but also it is nursing structure for 24/7 situation. And so we're in a situation where you are never going to have your top managers in the building at all times. And so now not only do you have to have your top level management, but then now we are trying to develop shift leads to figure out, all right, how do we make sure that at 24 hours a day, we have someone who's that go-to person when there is a crisis. And it's those types of things that, looking back on it, it would have been like, of course we should have known this. This is an obvious thing that we needed to address. But coming into it from bigger places, it was like we just took it for granted so much that it has been, one of the challenges to try to make that structure as best as possible for everybody.
Yeah, I think those are the big things. I think luckily we've had a lot of good people to help us along the way with everything else. We don't deal too much with the construction side of things because we have really good people to deal with that. But if that was on my plate, I certainly couldn't do that.
Yeah, I think as far as kind of, just to elaborate a little bit, the 24/7 stuff in general is just also difficult. It is that making sure that you have also representation for your employees who are on the overnights, so they don't feel like they're being ignored, devalued, stuff like that. Because changes are made by the people who typically are there during the daytime and may not appreciate what's happening overnight. One of the things that Emily and I had both done when we started was we worked some overnights. We had worked many overnights in our past, careers, at residence as emergency doctors, but now as critical care specialists, we don't do as many. But we wanted to do some in the beginning and occasionally, around, and also get people who are representing the emergency doctors, the nurses who also do overnights, to be able to make sure that everyone still feels heard and valued.
That's important. Mm-hmm. So then, speaking of being heard and valued, can you share some examples of how your team fosters mutual respect between the families and the pets that you serve and the healthcare team, and then also among the members of the veterinary team as well?
Sure. I think at the end of the day, we're a customer service service industry. I think especially being on emergency, all we're seeing is sick pets. We're giving them large estimates to deal with that. So you have to be empathetic to whatever they're going through. And I think that can take a toll on owners. It can also take a toll on us because a lot of times in emergency medicine, people can't afford the care that's offered. So we have to be okay with giving them other options. And I think our staff does a really good job in just being that support system. We've also put some things in place that we call compassionate care. So, diseases that we see commonly like pyometras or dystocias, we're able to help the community at a cheaper cost than other specialty hospitals, just because we want to give back to the community and be there to provide that care. So I think that's kind of the big aspects with customer service. Being a team member and what happens in the back is so important. And, coming from these large scale kind of corporate hospitals where we just felt we didn't have that representation, or so much from top down was happening that there was so much disconnect from what's actually happening on the floor, that I think the fact that our management structure and the managers are on the floor. I'm a full-time clinical doctor on the floor. I know exactly what's going on, and I can relate to my staff with their issues. And then the fun parts is getting them involved in those solutions. So, hey guys, these are the issues we're coming across. What are solutions that work for you guys? And so we can create a more collaborative environment to fix those problems.
Sorry if I seem distracted. I'm trying to figure out power cords to make sure my laptop doesn't die in the middle of this. It's not
all good. It's all good. Now, we know that compassion fatigue and burnout are, weighing kind of on the veterinary community. And kind of what you just said earlier reminded me about that. Like, are there ways where that's any different, particularly in emergency medicine? And then also kind of how is your practice empowering you to address those?
Yeah, so definitely is I think very difficult in emergency care because just the volume of cases, euthanasias and stuff like that are much higher. A lot of times, general practitioners and things like that have that that benefit of being able to ship something off, and then the owners get the bad news at the the emergency clinic where we can't do that. As far as ways that we have, sorry, we might have to switch computers after this question, but do that. As far as ways that we've done that, one of the things that we actually just instituted is we had a social worker come in to actually talk to the entire staff about compassion fatigue, about burnout, about grief and loss. And this was super helpful because it was a lot of it was validating, our team members' feelings of grief, sadness, loss with not their own pets. These are patients that we really invest in. And sometimes it feels awkward for us to feel sad and grief about the loss of these patients. And this was a great chance to enable them to really process that and feel that and provide tools to try to help avoid burnout, avoid stuff like that. So I do definitely think for bigger hospitals, having on-site social workers is a huge benefit. But even a smaller place like we are right now, having these things occasionally and having access to these tools, I think is really, really important and valuable. Let me just grab a different computer real quick and we can continue. Sorry about that.
I can continue.
Yes. Actually, I wanted to circle back to something you said before about the compassionate care, like around like two specific disease conditions that you mentioned. Can you elaborate that on a little bit? Like, what exactly does that look like for your practice and for your clients?
Sure. So pyometra is an infection in the uterus that we see commonly in dogs that aren't spayed. And all they need is to get spayed, but obviously these guys can be a little bit sicker just because they have a systemic infection. But a lot of times general practices can't always facilitate these patients, and going to specialty hospitals can be very, very expensive. So there's this huge gap where this subset of patients get euthanized. And we felt this is an easy procedure we can do. So we have some ER doctors that cut, so the surgery itself doesn't have to be done by a boarded surgeon, so you can decrease some cost there. And sorry, so for out of the specialty hospitals in the area, we are thousands of dollars cheaper for that procedure. So, it one, allows us to have that business, but two, I just feel that we can not have to euthanize these patients. And then the other one is a dystocia. So a pregnant dog that's having difficulty giving birth, where, again, all they need is for surgery to have a C-section, and that can be very costly. And unfortunately, without that, that dog is going to die. So are those puppies. So it's heartbreaking to not be able to help those patients. So we decided that that's what we were going to do and try to help that subset.
Okay, no. Very good use of your skills. Very nice. I see it's definitely community focused as well. I'm not sure if we wanted to wait for Eric to pop in, or I can ask you the next. You the next question. You're right. All right, good.
Here, and I'm logged in with the other computer. It'll be 5 seconds.
All right. I guess. Well, Emily can maybe start to answer. So what advice would you share with other veterinarians who are interested in either adding on emergency care or doing what you did and opening a standalone practice? Kind of what would you say to your peers who were curious? about this, either from a clinical or a practice management perspective?
Sure. I mean, I think taking on a 24/7 service is a really big undertaking. I think the first important things to decide is, do you want to truly do emergency care or do you want urgent care? I think there really is a big difference, and we're getting to that point in our profession where we need to differentiate. We are similar to a human specialty hospital where you go to the large ER versus if you go to an urgent care for your ear infection, lameness. Get off.
Sorry.
Right.
Hello. Sorry about that.
It's okay. It's all good. Emily was talking about, there you are. Hello. She was talking about the differentiations between, actually, maybe you could maybe
Yes.
expand on that a little bit, the difference between urgent and emergency in veterinary medicine, and kind of
Yeah.
what you would tell others on that.
So in my view, and again, I'm coming as a criticalist who is probably a little bit biased because we're a specialist in emergency care, is just that emergency medicine is going to be those sick patients that need emergent care, that need to get hospitalized, that need an ultrasound, that need emergency surgery, something of that sort. Where an urgent care is your stable dog with lameness, your ear infection, some brief vomiting, anything like that can kind of go in and go out. So just kind of differentiating what you want, because if you truly want to see emergencies, I believe that you need to offer other services, and you need to be available to support those sick emergent cases.
I think one difficult thing a lot of times is education of pet owners, because I think that they many times also have difficulty distinguishing between urgent and emergent care. And so when offering urgent care, you will inevitably get emergencies that come in, and to be able to make sure that you're able to stabilize and do things that are indicated that are life-saving right then and there before you get them to the emergency hospital can sometimes be difficult. And so making sure that when you are starting that type of hospital is to make sure that your clients know very clearly what you offer and what types of cases that you see, and make sure that you're training also your front desk staff and your receptionists very clearly to be able to distinguish, is this an urgent care that we're happy to see? An owner comes in, my dog has an ear infection, I can't get them into my primary care vet, it's driving us crazy. That's miserable for that dog. Absolutely, it should get seen sooner, but urgent care absolutely can do that. Versus, my cat is having difficulty breathing. That's something where if you're not able to potentially hospitalize or do more kind of advanced things, having them come to an urgent care to then just have to transfer to an emergency clinic can be more difficult. And so I think that educational part is really important, and can really make it difficult to try to do an urgent care only in veterinary medicine, just because those types of knowledge things for pet owners don't quite exist yet.
Okay, that's good. And then I want
Danielle.
Sure.
I'm sorry, Danielle. Can I jump in and sorry for the interruption.
Go
A
for
side
it.
question to that. Do you guys, with your clinic, do you do any type of telemedicine, telehealth calls that could potentially kind of, in essence, triage the case as to being, this is truly an emergency versus, it's more of a, let's make an appointment kind of thing?
Yeah, we don't. People call in. I think it's a really difficult thing to do because I think that, again, owners don't always really know what's going on. And I think, again, having that really, if you have that really good trained staff that can do that, that could play a role. But I think it's a little difficult at this time.
Yeah, and it is very difficult to assess a patient at home, even for me. When my cat is sick, I lose my head and don't know what to do, and I end up like bringing them in, and sometimes I'll have Emily or one of the other staff be like, yeah, everything's fine, like calm down. And so if me, a trained criticalist, sometimes has that moment of I can't really assess my own, pets well, trying to explain those things over the phone, especially without a previous relationship, can be super difficult. I think for those pets that have had already been evaluated and then they go home and they have some additional questions and it's trying to figure out, all right, bringing them back in versus staying at home, I think that's a lot easier. But especially without that initial relationship, it's just so difficult to understand what is the pet owner's capability of assessing their pet, what is truly happening with that animal. And so I think that we really try to encourage, and I think it's the right thing to do, is to get them assessed. And the worst that happens is we take a look at them and say, actually, everything's fine. You don't even need to be assessed. We try to do as much as possible when indicated, what's called triage away. And so if, the owner brings in their dog for, a mass on its, skin that's been there for 3 months and the owner's just like realized it, we can say, okay, no charge for an exam today. Just make an appointment with your primary care vet. It'll all be okay. But it still is important to have seen that rather than trying to deal with things over the phone, which again, I think is just very, very difficult.
Okay, good. Well, thank you. Appreciate the insight there.
I did have one additional question, but Amy, I was going to pop it over to you to see if there was anything more around the emergency care aspect of our call that you would like Eric and Emily to speak about.
No, I think I just had that one previous question, and I think otherwise we've done well so far. So back to you.
Okay. And then finally, we want to talk to you a little bit about your perspectives on MWI animal health, and just kind of ask, are there any programs or services kind of in particular that have helped you? Are there any ways that we at MWI have in any small part helped you with your growing business and success?
Well, I would say MWI didn't have a small part. They had a large part in growing our business. We do most of our ordering through MWI, equipment, drugs. They've been very helpful in finding supplies. I would send emails of, hey, I need something like this. And then they have been so great with finding either that or other options. So, we probably wouldn't be here without you. So,
yeah, I think that what's so important, especially when, thinking about specialty practice or rather emergency practice compared to general practice, is if you run out of something in general practice, it's usually not a huge deal. It's either there's another product or you can have an owner order it online or something like that. In emergency medicine, everything's an emergency. When you run out of this one piece of equipment, especially, Emily and I, we have already become pretty set in our ways for things, and we want that piece of equipment. And if you have a company that is responsive, has a good array of options, and you can get those things quickly or have other options available, that's huge. If you're doing your ordering from a bunch of different places, eBay, for equipment and things like that, you'll run into problems where things don't work, it's not reliable, and you don't have anybody on the other end of the phone to actually help you through a crisis. And so having a distributor to actually be able to do that, I think, is so valuable for an emergency hospital.
Oh, that is very heartening to hear. Definitely appreciate it. That was all of the questions I had teed up. I guess, is there anything else that you think your fellow veterinarian would be interested in knowing about the work that you're doing at PACE?
Yeah, I think that, opening up an emergency hospital is it's a big bite. And I think that we are learning, even as specialists who do this, all day, every day for our careers, we are realizing how much of an undertaking it is, and how important really partnerships are, rather than a mentality of a single place can do absolutely everything. We don't do general practice. We don't want to do general practice. And so developing those relationships with general practitioners is so important, is to make sure that cases that don't need us get to their general practice. Cases that do need us can easily get from their GP to us. And so I think sometimes deciding about, whether to expand into urgent care, whether to expand in emergency, one of the first questions probably would be, is this something that I can do rather than myself, is do it through a relationship, do it through, getting on the phone with that local emergency hospital and saying, all right, how do we better work with each other to make sure that these, pets are getting the best care possible between the two of us, rather than just say, oh yeah, we can just do everything. Because, anybody who tries to do everything quickly realizes that you eventually, have difficulty doing everything. And so I think that's a really big part of it. And even as a specialty hospital, we have to learn our limitations as well, and know when to sometimes refer off to a academic hospital, with things. And so I think that is, it's a lot of work, and I think it takes a lot of thought and foresight to see if that is going to be right for a practice to kind of expand into that.
Very good. Well, thank you to both of you for taking the time today to answer our questions. I think this is going to make for, a very interesting article. It's a side of the industry that I personally didn't really know anything about before we talked, and hopefully we'll be able to educate some of our readers who are also interested in becoming veterinary entrepreneurs like you all. So we appreciate it.
Great.
You're very welcome.
Thank you.
Whenever you take care and enjoy the rest of your day.
Thanks. You too.
Bye.
Thank you. Take care. Bye-bye.